Pregnancy anxiety, especially for older moms, is an important but often overlooked topic. As an older mom myself, I know firsthand how stressful and worrisome this time can be. From increased health risks to societal pressures, there's a lot to navigate. But I want you to know that you're not alone, and there are ways to manage this anxiety in a healthy way. Let's start by addressing the elephant in the room. Yes, older mothers do face higher risks when it comes to pregnancy complications. Knowledge of these risks can certainly be anxiety-provoking. Conditions like gestational diabetes, preeclampsia, preterm labor, and genetic abnormalities such as Down syndrome are more common. But here's the thing: knowledge is power. By being aware of these risks and working closely with your healthcare team, you can take steps to mitigate them and have the healthiest pregnancy possible. Pregnancy anxiety and other perinatal mood disorders like depression are incredibly common, yet they're often brushed aside or stigmatized. Studies show around 15 to 20% of pregnant women experience significant anxiety symptoms. While some worry is normal, it's important to address excessive anxiety as it can negatively impact the pregnancy and the mother's well-being if left untreated. The unfortunate reality is these conditions are a leading cause of preventable maternal mortality and morbidity. They can have serious consequences for both mom and baby if left untreated. So, what are some common causes of pregnancy anxiety? Natural increases in the pregnancy hormones, estrogen and progesterone, can contribute to feelings of anxiety, depression, irritability, sadness, and fatigue. In addition, a personal or family history of mental health conditions, prior trauma, a history of pregnancy complications, or complications on labor and delivery are all potential risk factors for pregnancy anxiety. Pregnancy anxiety can look like feeling nervous, jumpy, or on edge, excessive worry about your health, your baby's health, or birth prep. Difficulty falling asleep or staying asleep, trouble relaxing, inability to focus, intrusive thoughts, panic attacks, low energy, low sex drive, depressed mood. You can address these worries in different ways based on your level of anxiety. Relaxation, an often overlooked aspect of well-being, is a key strategy for reducing anxiety. Studies have shown that being intentional about physical relaxation can reduce maternal stress. Whether it's listening to music, practicing prenatal yoga, indulging in a warm, soothing bath, practicing mindfulness through meditation, or simply curling up in a cozy corner with an engaging book, engaging in activities that are calming can significantly reduce anxiety levels. Nutrition is another aspect that plays a critical role in managing emotions. Emphasizing on healthy eating habits and ensuring adequate hydration can profoundly impact your physical and mental well-being. It's astonishing to realize how much a balanced diet can influence your mood. For example, foods rich in omega-3 fatty acids, such as salmon and spinach, help support healthy brain function. Studies have also shown a link between vitamin D deficiency and anxiety in pregnant women. In addition, you may want to consider limiting your sugar and caffeine intake, as it can exacerbate feelings of stress and anxiety. Consider cognitive behavior therapy with a licensed therapist. This is a very effective method to help you identify what triggers your anxiety so you can develop healthy coping mechanisms. Quality sleep, which is hard to come by during pregnancy, is another integral component for maintaining emotional health. You may want to consider carving out time for napping during the day, sleep hygiene techniques like limiting screen time, wind-down activities like reading before bed, or use of a pregnancy support pillow. Ensuring that you are getting a good night's sleep can work wonders for your mood, energy levels, and overall well-being. For those who enjoy physical activity, incorporating fun and light exercises into your routine can be a fantastic way to manage stress. Activities such as prenatal yoga or light walks can be incredibly beneficial. But remember, it's always best to consult your healthcare provider before starting any new physical activities during pregnancy. Lastly, it's essential to remember that it's okay to ask for help if you're feeling particularly overwhelmed. Everyone at some point in their lives needs a helping hand. There's no shame in seeking support and relying on others during challenging times. This is especially important if you are experiencing persistent or worsening symptoms. Discuss your concerns with your OB team. Together, you can decide which management strategies may be best to help meet your needs. This may include a referral to a mental health professional and initiation of medications. Every woman has a unique journey. What works for one might not necessarily work for another. Recognizing these feelings early and addressing them can make a significant difference. Pregnancy, while a joyful time, can also be tough and challenging. But with the right strategies, a supportive network, and a positive mindset, moms-to-be can make their journey to motherhood a lot more peaceful and joyful.